Well, what do you think? Of course they do. Toothpastes are made to remove the debris from the teeth. Do they wear the teeth down? Well, some people think they do. Do they wear them excessively? Do foods wear teeth down? Yes. Yeah, even the occlusal surfaces of enamel wear somewhat less than the diameter of one human hair per year. That means over 20 and 30 years you've worn pretty well most of the enamel off. Teeth wear. All of these toothpastes take away a minor amount of enamel or dentin. This is a code that's being used to evaluate the abrasivity of toothpaste, the relative dentin abrasiveness code. And I'm going to show you where toothpaste fit into that in just a moment. 0 to 70 is low abrasive. Very few are in that area, except children's toothpaste are often that low. Then there's the medium, 71 to 100. There's a highly abrasive, 101 to 150. And then you better not get too many brushings with one at 151 to 250. That's regarded as a harmful limit. Look at these toothpastes. You'll know most of them. Those abrasivity tests are available on all the brands of toothpaste. They have to get approved or cleared through FDA. FDA recommends up to 200. The highest, and there are some that are supposed to take off tobacco stain and miscellaneous other junk on the tooth, are around 250. But as you look at those that you know fairly well, look at Crest and Colgate at 155, 160. Look at Crest Regular at 110. And I think what's interesting is baking soda. Surprisingly, that turns out very well in the scientific evaluations because it is obviously highly basic. And almost every food you and I eat is highly acidic. There are very few foods you can eat that have a pH higher than 3. Almost none. Almost every time you eat, when you're finished eating, your mouth is completely acidic. Not with baking soda. As soon as you throw that in there, you just neutralize all of the problems that would occur with that acidity that remains there. And particularly when you eat something like a gummy bear. Oh my goodness, that sticks on those teeth for a long time. And how about something like Sour Patch with a pH that's lower than battery acid? I'm not kidding. We've tested it. Is it time to look at some of these more basic toothpastes? And what about the toothpaste, though? What is in toothpaste? Look at the different types there are. I don't know that I need a multi-purpose toothpaste that does perio and does caries and does desensitization, a whole gamut. I don't need all that. But most of you are using standard toothpaste and recommending those to your patients. And you see something that's really important. Fluoride-containing toothpaste are the average of 1,000 parts per million fluoride. Your high fluoride-containing toothpaste are a prescription item in the U.S., not in most other countries, and that's 5,000 parts per million. 5,000 parts per million should be in about 10% of the patients in a general practice. There's no question in my mind. Why? Because we eat so many acidic foods, and we don't clean our teeth well. Very few people do. Rella, who all of you know, did a study years ago, and she was a hygienist then before she did a doctorate, and she found that if she even took all the time that she could conceivably want to clean 6 anterior teeth, the electron microscope still showed enormous garbage left on the teeth. You cannot get rid of it. So it's time to look very seriously at where do your patients fit? Are they sensitive? Obviously potassium nitrate. Are they carious all the time? Maybe the 5,000 parts per million fluoride and some baking soda. You have to figure that out. And if it's a kid, get something that tastes like bubble gum or other things that are desirable to them. Well, yes, toothpaste wear teeth. So teach the patient how to brush their teeth well, how to clean all the biofilm off there, and that little bit of wear that occurs is not excessive at all. Thanks for being with us. Join us next week.